Hey, Whitney with Redeemed Strength. Just wanted to do a quick video on something we are dealing with right now, which is extreme heat. So first of all, I just want to do a quick shout out to all of the local gyms in the area. I know that they are working extremely hard to keep their spaces nice and cool because I know that we are. So huge shout out to all of our local gym owners for trying your best to keep your gym as cool as possible and as safe as possible for all your members. So first of all, number one thing that we need to do with the heat is we need to hydrate. Hydrate, hydrate, hydrate. And that hydration does not start inside of your workout. It starts well before that. If you are somebody that gets up first thing in the morning and knocks out your workout, then your hydration needs to start the day before, at least the day before, okay? So when I'm talking about hydration, I am talking about drinking lots of water, sports drinks if that's what you like. I'm not a big fan of all the dyes and colors and flavors and all the things, but if that's what you drink plenty of it. Make sure you're getting your electrolytes in, so your sodium, your potassium, and your magnesium. All three of those things are extremely important for skeletal muscle and also for your heart muscle. So we want to make sure that we're getting in adequate amounts of that as we are losing them in the extra work and the extra perspiration as our body is working really hard to cool us down. Also, another note with that, anything that is caffeinated. So your coffees, your sweet tea, even your green tea, anything that has caffeine in it is actually going to work on your kidneys and tell them to diurese, which means you're losing fluid. So as a general rule, that does not count towards your hydration. I tell all of my patients and all of my people that are training, if you drink 8 ounces of coffee, you need to replenish with 8 ounces of water, and that 8 ounces of water does not count towards your daily intake because you need to offset that caffeinated beverage. So I like to say get in at least 64 fluid ounces of water as your baseline, and then add to that as needed based on your body size and how much activity you're getting in. So if you're somebody that exercises later in the evening, you can get away with doing most of your hydration the day of prior to your exercise. But please, please make sure you're hydrating. That will help your body tremendously. So the next two things I want to talk about are heat exhaustion versus heat stroke. Now, your body will start in heat exhaustion, and if it is not taken care of, recognized, if it's not handled, it will lead into heat stroke. So what kind of things can we look for when we're looking at heat exhaustion? Number one, profuse sweating. Now, we're all working out or we're outside doing things and we're sweating, right? But you kind of know your baseline. So this is above and beyond what your body's natural sweating amount would be. Your body's really telling you, hey, I'm working really hard to cool you down right now. With that extreme sweating, you can also have some dizziness. You can start having really fast heart rate. Tachycardia is what we call that. But all of that is due to the vasodilation of the veins and the arteries at the surface of the skin. So that just means they're dilating. Okay, when things dilate, there's less pressure. When the blood pressure goes down, the heart has to compensate, so that heart rate goes up. It also is shifting all of that blood flow peripherally, meaning to arms and legs and the outside of your body, because it's working really hard to try to cool you down. But what that does is it takes the blood flow away from the internal organs, lungs, heart, especially the gut, and it just makes it harder for your body to function like it needs to because it's working really hard to cool you down. So nausea and vomiting are some things that you might notice, which might make it harder for you to keep getting fluids in. So also you can develop a headache, you can be pale, you can be clammy. All of those things are telling you that you are pushing it a little bit too hard, even if that's your baseline. The temperatures are just not allowing for you to keep that baseline. Listen to your body, scale it back. If you don't scale it back and react, the next thing is you will progress into heat stroke. Heat stroke is 100% an emergency, and whether you experience it yourself or you witness somebody that is experiencing it, you need to call 911. Heat stroke means that the internal temperature of your body has peaked at 104 or maybe above, and that is not sustainable for life. It can cause permanent damage to internal organs, and so we definitely want to react really quickly if we experience this or we witness somebody that is. Signs of that are actually your body will stop sweating. It gets to the point where it just cannot even function at that level anymore, and it's conserving everything that it can fluid-wise internally. The skin will become dry. It will become very, very red, and you will see that that person definitely looks like they're too hot. They may have slurred speech. They may have vision changes. They may have like an altered mental status. They're not answering your questions appropriately. They actually may have seizures. So once the internal organs, the brain, reach that temperature, it can actually stimulate seizure activity. It can also stimulate heart arrhythmias. So not just the heart rate going up, but the heart rhythm actually changing. And that is very, very dangerous. So 100% is first thing you do is call 911. The next thing you do is move yourself or that person into the coolest place you can find. If you can get them in the shade if they're outside, if you can get them in the coolest part of the building, if you can get them in front of a fan, anything like that to start trying to cool them down. Also, if you have access to wet rags, if you have access to ice, you want to put those on the body where there's a lot of blood flow so that the body can take in that coolness. So around the neck is a really good place. Under the armpits is a good place. In the groin area is a really good place. And try to keep that body as wrapped in all those cold cloths, ice, if you can, and that will help bring the body temperature down while you're waiting for emergency services. So just wanted to put that out there. It's definitely, heat is a very dangerous thing. A lot of people tend to underestimate the damage that heat can do. So I just want you guys to keep training, stay strong, but be safe and be aware. Have a great day.